Ever feel like your bladder is completely running your life? Well, you are definitely not alone. Today, we're going to demystify something called male lower urinary tract symptoms, or LUTS for short, and we're going to do it using the official 2025 guidelines from the European Association of Urology. Our goal here is to turn all that complex medical jargon into clear, useful information for you. You know, if you're planning your whole day around where the next bathroom is, or if you're getting woken up all night, you're in the right place. LUTS are super common, especially as men get older, and yeah, they can be a major pain. But the good news? There are absolutely solutions out there. So here's our game plan. We'll start with the basics, what LUTS even are. Then we'll walk through getting a diagnosis. And after that, we'll explore all the options, starting with simple lifestyle changes all the way up to modern surgery. By the end, you'll have a really solid map of the whole journey. All right, let's dive right in with the most important question. What on earth are we actually talking about when we say male LUTS? Okay, this is the most important thing to get right off the bat. UTIs are not a disease. Think of them more like your body's check engine light coming on. It's a signal that something's going on with your urinary system. And, as the guidelines make really clear, it's a super common part of aging that can be caused by a bunch of different things. The experts break the symptoms down into 3 main buckets, which is actually super helpful. As I'm talking through these, just kind of see if any of them sound familiar. First, you've got storage issues. That's when you have to go all the time, or you get that sudden urge. Then there are voiding symptoms, things like a weak stream or having to push. And finally, post-micturition, that annoying feeling that you're not quite done or a little dribble afterward. Okay, let's address the elephant in the room, because I know where your mind might be going. It is totally normal to worry about cancer when you notice changes down there, but the guidelines are very, very clear about this. Having these urinary symptoms is not directly linked to prostate cancer, so really, you can take a deep breath on that one. So you've identified some symptoms, and hopefully we've eased that big worry. What happens next? Let's talk about getting a diagnosis, which is really just a structured way for your doctor to play detective and figure out what's really going on. This whole diagnostic thing is really just a step-by-step investigation. It all starts with a simple chat. Then you'll probably fill out a questionnaire to help put a number on how bad your symptoms are. After that, an exam and some simple tests. That last one, uroflowmetry, that's just a fancy word for a machine that measures how fast you pee. It's all about gathering clues to solve the mystery. I absolutely love this analogy. It just perfectly explains one of the most common culprits, benign prostatic obstruction, or BPO. Basically, as the prostate gets bigger with age, it's like someone is standing on a garden hose. The water is still there, but the flow is all choked off. It's such a simple way to picture what's happening. All right, we understand the problem and how doctors figure it out. So what do we do about it? Well, you might be surprised to hear that the first line of defense is often the simplest one. This is actually a really empowering idea from the guidelines. For a lot of guys, if the symptoms are mild and not really bothering you, the best thing to do can be, well, nothing. It's a real medical strategy called watchful waiting. The key thing to know is that symptoms don't always get worse over time. For many men, things stay stable for years, so just keeping an eye on it with your doctor is a perfectly good plan. And while you're watchfully waiting, these little lifestyle tweaks can be absolute game changers. Take double voiding, for instance. Ever heard of it? It's simple. You go to the bathroom, wait a minute, and then try to go again, just to make sure the tank is really empty. It's these kinds of small, proven changes that can make a massive difference. Okay, but what if those lifestyle changes just aren't cutting it, and the symptoms are really getting in the way of your life? That's when we start talking about medication. Let's look at the main players. So you've basically got 2 main teams here, the relaxers and the shrinkers. Alpha blockers, the relaxers, are the fast-acting crew. They provide quick relief by just relaxing the muscles around the prostate. The 5-ARIs, the shrinkers, they play the long game. It can take 6 months or more, but they actually shrink the prostate itself. It's all about tackling the problem in different ways. So do these relaxers actually do anything? Oh yeah. The data is super clear. Studies show that alpha blockers can slash those symptom scores by 30 to 40%. I mean, that is a huge, noticeable improvement compared to a placebo. So we know this stuff really works. Now for the important part, the side effects. You know, pretty much any medication comes with potential trade-offs. The relaxers can sometimes make you dizzy, and the shrinkers can sometimes affect your sex drive. This is why having a really open, honest conversation with your doctor is just absolutely essential. You've got to find the right balance for you. And that brings us to the final stop on this journey. For some men, when nothing else is giving them the relief they need, surgery can be the best path forward for a real long-term fix. Let's see what the modern options look like. Forget all the complicated surgical names for a second. This slide makes it so easy to understand. Just think about the goal. Is the surgeon trying to trim away tissue? Or maybe remove the whole inner part that's causing the blockage? Or perhaps vaporize it with a laser? There are even ways to just reshape the pathway without removing anything. Each has its pros and cons. And here is the really exciting news. Surgery for LUTS has changed a lot. We're not talking about some huge, old-school operation anymore. Today, there's an amazing menu of minimally invasive options designed to give you relief, but with a much faster recovery. It's a whole new ballgame. I want to end on this quote because it comes straight from the guidelines, and I think it just sums everything up perfectly. It says, this information is meant to help focus decisions, taking personal values and preferences of patients into account. And that's the whole point, right? This isn't a rule book. It's a guidebook to help you and your doctor make the best choice for you. Wow, we have covered a ton of ground. You now have a solid understanding of this whole LUTS thing, from what it is to how it's treated. So the real question is, what are you going to do with this knowledge? The power really is in your hands to take that next step, have that conversation with your doctor, and get back in control.